Jane, I had so much fun recording with Dr. Josh. We did his podcast and then we just loved talking to him. So we asked him to come on ours and we had a great conversation all about holistic healthcare. He's got some wild stories to share. What did you think of Dr. Josh?
I love Dr. Josh. He's so smart. Too. He's very grounded. And then he's got this great history and he has provided healthcare in so many ways. He was talking about going out to help people who lived in caves or the swamps swamps. He's a dedicated healthcare professional. But I really enjoyed our conversation. He's got a really holistic view and kind of blows some ideas out of the water about kind of one size fits all healthcare and mental health care. And I think that's a pretty important conversation right now.
And he's got some really good hot takes. We kind of talked to him all about this wellness industry and supplements and this protocol, this one size fits all. And I think he's got really, really, really good insight and tangible takeaways all about how you can figure out what works for you and your body, and not everything is one size fits all for everybody.
For sure, which is one of the things you and I have talked about a lot. And one of our big complaints is one person is trying to sell something or a supplement worked for them, or they only eat meat for 70 days and whatever. And maybe it worked for them, but it's not going to work for everybody. And he really gets that and kind of shares that on the podcast. So I think people will get a lot out of it. He's got his own private practice. He's a professor at Yale and he's got a really interesting history. So
from the caves and the swamps to Yale, Dr. Josh has really done it.
He's done it all. And he's about to tell us all about it.
Thanks so much, Dr. Josh. We love you. Welcome to Are We Happy Yet? I'm Hannah Buzzo, licensed therapist.
And I'm Jane Thatcher-Hahn, licensed clinical social worker.
We're two longtime friends deep in the work of helping people untangle their lives.
And let's be honest, untangling our own along the way.
We started this podcast because even as mental health goes mainstream, more and more people are feeling anxious, disconnected, and burnt out than ever before.
So what gives? We're exploring how everything from therapy and psychedelics to culture, politics, creativity, and relationships shape our well-being.
Think of this as your weekly reality check, gut punch, and group hug all rolled into one.
We're here to ask the big questions, share what we're learning, and laugh a lot while we figure it out.
This is Are We Happy Yet? Let's get into it. Jane, I am just so excited for today's conversation. I know it's going to be so good. We have Dr. Josh from Arukah Wellness here. He's out of Florida. We actually met him because we were on his amazing podcast, Mental Maps. And we were just obsessed with his holistic approach. He's worked in so many different areas of the mental health space. So I'm just so excited to talk to Josh and have him here with us.
Hey girls, glad to be here. Thank you so much. I was hoping, it's always fun, like when you do a podcast and you get to meet people and then they also do a podcast. You're like, well, maybe I'll get to come on their show too. And then like you guys said, yeah. And I was like, absolutely. I'll love to talk about all kinds of fun things.
Yeah, it'll be
We're so happy to have you. We had such a fun conversation on Mental Maps and we did lots of talking. So we're excited to have you do more of the talking and hear about the work that you're doing and all of the ways that you're addressing mental health and engaging in that world. Yeah,
definitely will be a different dynamic, but I'm glad to be here. It's super exciting. This whole work it's so interesting. It's such needed. It's such an interesting topic. And so just to have this ability to kind of speak it out and kind of talk it with you guys, I'm excited.
Okay. So Josh, you've done it all. You've done like rural therapy in Tennessee. You're a professor at Yale. You created a mental health program inside a correctional facility. Like, do you sleep? And also tell us the story of you and how you're doing all that cool stuff.
Yeah, I definitely sleep, not as much as I need to. That is actually kind of my new goal, is to maybe try to sleep more and rest more. I'm kind of getting to that place. That's this whole other thing. But yeah, so I started out actually as like a bachelor's level, like case manager, right? And so at that time, that was when insurances was paying for people to like go into other people's homes and help them like connect with resources. And so we were in like rural Tennessee. I was going into caves and like homeless places, and we were just trying to find resources for people, right? Which was really interesting. And I would, Tennessee's got caves and people are living out in caves. And so you just hike out in the middle of the woods and find people in the
That's
caves.
the first. That's the first time I've heard that. That's pretty incredible.
That is the first.
Yeah. It didn't happen as much as you would like for it to, because that'd have been way more fun than some of the other homes that I went to be honest with you. But like, I learned a lot, and that was a really cool time because I was becoming a therapist at the same time. So you like learn stuff at school at night and then go work the next day. But then through that, I became a therapist. And as I was working as a therapist, I enjoyed it. I enjoyed doing therapy, but I also wanted to do more. And medicine always interested me. So I had that opportunity to bridge over and get into the world of being a nurse practitioner at Vanderbilt and got my doctorate there and all the things that kind of go with that. And from that, it's just kind of opened up this door of trying to integrate therapy and medicine. And as I was doing that, one of the biggest challenges I felt was that, I would do everything you taught and people still wouldn't get better. And it was so frustrating. You had these algorithms, and you give them this medicine, and then it didn't work. And so then you give another medicine, it didn't work. And so you're like, am I doing it wrong? And so you go back and forth. And what you found was that there was something missing. Like the holistic kind of concept. And so that's how I got into that world. And in the meantime, we created a psychiatric program inside our county jail, which was needed. I work in an area that doesn't have a lot of resources. And so because of that, our jail many times is kind of like a hospital, which is unfortunate, but we have a lot of that kind of going on there. And so a lot of acute stuff. So we have that. And then I do a lot of addiction work in the world of the opioid epidemic. And we create a Suboxone clinic and all the things that kind of go with that, which is something that, man, I've seen change people's lives. So that was kind of cool in the medicine world and those kind of things. But that then led me into the world of like integrative health, functional health, that kind of stuff. So I'm actually in Santa Rosa Beach, which is kind of interesting because, you're here near this famous county road called 30A, which is interesting in itself. It's being gentrified a lot and all the things that's kind of happening there. But what's interesting, you go 30 minutes north, across the bridge, and there's parts of that area that's a complete food desert. And there's no resources, there's no homeless shelter, there's no public transportation, there's nothing, so it's a really interesting dichotomy, if you will, of what you see like day in and day out. And so you get this really interesting experience of working with people who are on mansions on the beach. And then you go up and you see people who are living in the swamp. And so it's just this really interesting kind of experience, which is its own thing. So that's where I'm at here in Northwest Florida. So Arukah Well right now serves primarily all of Florida. We hope to get outside of the state of Florida, with some of the medicine stuff. Telehealth rules are really interesting right now. So we'll see kind of what happens with all that.
So I feel like holistic is a little bit of a buzzword, and I feel like it's like not really what it really means. So from your background, which even you just saying you've done in-home care and Suboxone and also functional medicine, that to me feels holistic because it's different ways of approaching a problem. But you tell us, what does holistic care mean to you in your practice and why is it important?
I think holistic treatment means that not one treatment works for everyone, right? It's being able to see a person for who they are and like where we can intervene with a specific intervention. I think so many times in healthcare, and I say healthcare in like all concepts of health, right? Whether it's therapy, kit, whatever, we have this one intervention and we feel like that's the thing, right? Like medicine is the thing, or this one therapy is the thing. And what we find holistically is that's not true, that there's a gamut of reasons why people become unwell. And so if we can kind of shift the mindset, if you will, of maybe it's not everybody gets sick the same way. Maybe everybody gets sick differently. And so then it requires its own intervention. And to me, that's holistic, is that some people do need a medicine. Some people don't. Some people need to get their diet right. Some people can get their diet right and still feel really bad. So it's just kind of like, where do you find that balance?
What's the barrier to that sort of integrative approach? Because I understand that people are trying, and people like you and, they're trying to set up an integrative approach, but there just seems like there's a lot of roadblocks and a lot of barriers.
Oh, man, I think like we live in a country where health is not a right. And it's really unfortunate about that. Right. But the right to healthy food isn't given to everyone. The right to the ability to seek help isn't given to everyone. And so I think that's probably the biggest challenge, right? Is that I can say, yeah, we need to eat a lot of really good food of like good meat and vegetables, whatever that looks like. But if you don't have that money, you're not going to get it. I'll never forget like working with people and being like, when I first got into this world and being like, well, let's try these like 7 foods. Right. And they're like, well, we live in a camper with a refrigerator that's about 2 things and we don't even have an oven. And so it's like, well, how do you do that? Because the stuff's going to go bad. And so I think that's the biggest barrier, right? Is just the access to it. I think when you come from that is then just the noise that's in it. Right. There's just so much information. Like Hannah was saying, it's such a buzzword when you Google it or you TikTok it, you Instagram it, and it's just so loud. Right. And so I think a lot of people just don't know what's right and what's not.
How do you help your clients with that? Because I feel like it's just like what camp and like what your algorithm is like what you think is right or wrong, right? Like I have a friend that tells me that vaping is actually healthy because it does something to your neurotransmitters. Yeah. So I'm like, what algorithm are you on? But I mean, tell us like how do we know what's real and what's not?
I think there's a version of truth for everything that's out there. And I think the problem is that we want to standardize it. Just because it works well for one person doesn't mean it's going to work well for everyone. And so the biggest thing that I try to do is try to help people understand, why did I become unwell? Right. So the whole concept of like the pillar system is something's out of balance in these pillars. And so can we figure out where it's off and then intervene that way? Right. I think whatever herb you're taking, or I mean, let's take nicotine, like you were saying. There are some people who take a little bit of nicotine and it helps them focus and concentrate and they feel great. Now you need to be vaping? No, because it's really hard on your lungs. But at the end of the day, some people get that experience and do very well with it and they feel like they're, healthy. But not everybody needs that. And so it's figuring out, why can't you focus in the first place? Then, you can intervene. I think that's the biggest thing, is it's less about focusing on the solution and more about figuring out why you got to that place in the first place.
Which is kind of going back to what you're saying. I'm like, it's wrapping in my ADHD brain. That's what makes it so hard, because unless you have access to all these practitioners that can help you, that have the time to sit down with you, that you have like the ability to self-reflect, okay, cool. But if you're living with a cave with no access to a refrigerator, like this standardized practice is not helpful.
Well, yeah. I mean, I think, labs are a perfect example, right? There's this huge movement for lab pulling, like about 5-6 years ago. And I do it too. I mean, we all do like the functional health labs. They're really helpful for some people, right? But if you don't have cash, you can't get that done. Managed care is not going to give that to you. You can get a B12 and a vitamin D if you're lucky, but you're not going to get a full vitamin panel and all those things. And so you are right that, you can get all this information. And then when you go seek it out, you're like, oh my gosh, like, how do I navigate it? And so for me, I think the biggest thing is just helping people understand, how do I know I'm not well? And then what can I do to intervene? Like, what's some base level stuff I can do and kind of build from there, which I think is the most important.
As you guys are talking, I'm just thinking about how influenced the medical system is by money and capitalism, right? So like, what can you if you can't capitalize it, then it's not going to show up in your feed, right, Hannah, to what you're saying? Like, what's the story we're being fed? What's the narrative that we all have? We all have very different narratives at this point. So I think that feels like a big barrier too of getting 8 hours. Nobody can capitalize on me getting 8 or 9 hours of sleep, right? Like nobody can really make money off of that.
You can if you buy a $300 alarm clock with personalized lights and music that I tried and it did not help me.
I was going to say, I have a bougie alarm clock too that like lights up my room and it gives me fake sunlight. And then I realized, no, it is 4:30 and the sun's not going to come up for 2 more hours and this is fake light and that sucks. But you are right that, in this world of like holistic, functional health, integrative health, we're very lucky that there's not a lot of oversight so things can come out, right? If we were living in the world of like Western medicine, there's this huge 3-4 phases to get medicine out and all the things. And that's a challenge, right? But there's a safety protocol that's needed. But one of the spins on that is when you take that away, it's just the Wild West. And so anybody that's got like a really cool thing to talk about or that help them can help everyone. I think you see that with diet so much, right? Like if that diet worked for me, that diet works for everyone, and so they're just flying the flag. I mean, you see people, they'll get, it's like religion, right? Like it's wild. And I think it's just because of that, right? It just what works for one person, it works for everyone in their mind.
So in your practice, and I know I'm like doing exactly what you just told us not to do, which is ask for an answer. Like in your practice, what are the top root causes, like drivers of depression, anxiety, addiction? Like if you could say a top 3 or 5 that you see, what's driving that?
I think the first would be stress, right? Just like day-to-day stress. Not that you're weak as a human being and one person's stress. I think whatever your experiences is so loud that it's just really hard to manage day-to-day life, right? Whether it's finances or relationships or, stuff from your past, like whatever it is, I think that seems to be the biggest driver. And then just trying to keep up in that world, right? So you're in this place where there's all this noise and you're in social media and you're trying to do things. I think that whole thing is kind of the greatest driver. I would say the second one would just be the quality of the food. right, is really big. I think that everybody's got their own diet and, you know, we can riff on that. But at the end of the day, it's just, is your food healthy? You know, like the amount of people you see, this is like they're eating one meal a day and that is like a protein shake. And you're like, man, your brain has no gas. Like it's like getting in your car and you're already on like empty and saying like, oh, I'm not going to have a 3-hour drive today. And so then you get to 10 a.m. and you're just like crashed. And so I would say that's a huge driver. And so then like they try to use supplements and all the things. So I would say stress, I would say diet, I would say sleep, right? I mean, we're in a world we don't sleep. And this has come from someone who doesn't like to sleep, right? If I could stay awake and just work all the time, that'd be fun. But then I realized like that's not healthy and that's probably going to like make me crash and burn. And then I would say the third would be just how you spend your time. Like I think a lot of times as adults, we kind of lost like what is fun for us. What is our hobbies? What is our interests? What are those things? And it's so funny that we forget those things. And then we just get so burnt out and wore down. And then it's like, what do I do now? So I would say, you know, those would be the 4 that are the biggest drivers underneath like a diagnosis and symptomology and all the other stuff.
You said something earlier that's sticking with me. You said something about helping people understand when they're not well. Does that come because you're seeing people who aren't well and don't know it, or we're just so used to it? Or, I mean, how do we know if we're well or not well? And can we put people in those camps of well and unwell?
Yeah. I think that's one of the interesting concepts of like this whole world that like we're talking about, right? Is that, you know, for us in the world of the DSM coding and we just put a code on it and we bill for it and you have depression or you have anxiety. I really like a lot of the work that Chris Palmer done, you know, at Harvard, where he talks a lot about like hyperactive and hypoactive in your mitochondria, right? And so he talks a lot about how, why does the medicine for depression and anxiety both work for the same illness? And some is just hyper and some is hypo. So I can be hyperactive, crying spells, eating all the time, not sleeping, but still be coded as depressed. Where I could also be laying in bed, not eating and sleeping too much and also be coded as depressed. So the goal is to figure out why you're up or why you're down, right? Like what's pushing you down or what's bringing you up. And he does a lot of work in the mitochondria stuff. I would say my work really comes out of the world of what is going on to kind of make that happen, right? So I have 4 pillars. You know, one is the body. The second is the mind. The third is your environment. And then 4th is spiritual. And for some reason, one of those gets out of line, right? So when we're in line, we're in complete balance and all 4 pillars kind of hold up that table. But for people when they're like unwell, right, when they don't feel good, something's off. And so unfortunately, we just like pick one thing. We're like, that's it. But we've got to figure out why that is it, right? Like, I mean, the amount of people I've seen who, you know, they have depression and it's like coded as depression, but then we look at their stuff and they have a thyroid disorder, right? Or like they come in and they're having anxiety. I remember like seeing this person, they were like having all this anxiety and anger and irritability and they were on all these medicines. And then we pulled some stuff and they had celiac disease. They were eating gluten all the time. And so we got rid of the gluten and they felt better. Now, does that for everyone? No. Like I see other people who are anxious and, you know, irritable and they take Prozac and they get better, right? So not everybody's the same, but that's the goal, is to figure out how you got unwell, right? And wellness meaning that, do I feel the way that I want to feel day in and day out?
It is amazing to me, just the number, my client base is primarily women, the number of women who sort out their thyroid and hormone issues and then feel significantly better, and how long it takes them to get those issues sorted out and how much distrust their professionals have for them around what's going on. I mean, I have clients who are like 2 weeks and the thing I've struggled with for years is completely different. And there's no quick fixes. I should, let me throw that out there. But it is interesting that we could be looking at the wrong thing for so long, Yeah.
I mean, I think you see it in so many disorders, right? Like, I tell my students all the time too, schizophrenia is a great one, right? Like the amount of people who will come into the hospital with a psychotic disorder and we just give them medicine, put them to sleep, and then they go home, right? Rather than doing a full gamut test of like a spinal tap and all these things. What if they have encephalitis? What if they have Lyme disease? What if they have, all the different stuff? And I think that's just one instance where there is a version of people who, if they can just figure out whatever is wrong with their body, that's going to fix their mind. Right. And I think you see it with females a lot. Men's the same. Testosterone. How many men you see that'll just be like sluggish, low libido. They feel depressed. They don't want to do anything. And then they get their diet right. Or maybe they end up getting on like hormone replacement, whatever. And they just feel so much better.
Which speaks to me of how important it is to have someone that is like actually holistic and integrative, right? Because in my mind and, you know, just in my practice, it's like I have some clients that are trying to figure some of this out. And it's like, okay, so they go to their doctor over here and then whatever information they get. And then they come to me from the mental health and whatever information they get. And now they go over here to the neurologist. And right. I just think like the way we view humans traditionally in the medical model is split into different factors that actually are so interlapping that I think make it really overwhelming and time consuming and expensive for folks to navigate. What are your thoughts on that?
I would agree with that. And I think, you know, you're also talking about time, right? You know, if I'm in a community mental health center, I get 15 minutes with you, right? That's it. And I got another 30 people I got to see today, you know, and I've lived that world as a provider. And so how am I going to get to learn if you actually have like a hormone issue in 15 minutes?
Yeah.
That's not going to happen. And so I think a lot of it is the time constraints requires there to be so many people talking, but then no one talks together because everyone's so busy. And then we have this one thing that worked for maybe this one person, and then that doesn't work for this next person. And so then that person gets very frustrated. And so then we start kind of trying different things. And so then we start using more providers to try to find our way through. And I think it just gets really loud. And it gets really confusing. I see people who experience that, and I think it's just such a challenge, right? But then again, I also recognize that like integrative care is also a very, you know, first world kind of problem, right? Like it's the ability to intervene in a way that's not insured driven, that's not, you know, it's just very different in that way.
But I like your focus on the concept of, I can't even remember exactly how you said it, but that health is not a right in this country, right? It's something that we have access to often based on our income or where we live or who we know or how much education we have, or do we have physicians in our family or therapists that we know, you know, that's thinking of it in that way. It feels, I mean, it always feels unfortunate, but it feels unfortunate that we don't value that, right? As a human right that everybody should just be entitled to. I mean, that's kind of one of the pillars of how insurance companies make money and how hospitals make money. So it sounds like in your practice, someone can come in and somehow you are like addressing all of that, or you have tell us how you look at all of the, like, take all of those pillars into consideration and understand all of them for a patient.
Yeah, I think so. Step one, you know, for what we do is just spending time listening. Right. There's a gamut of questions we use that I've kind of worked through over the years to try to figure out like guiding our way through there. Right. And so it's just going for each domain. Like we're going to focus on the body, and then we're going to focus on the mind, and then we're going to focus on your environment. Right. That meaning not only like what you're living in, but then what is the world around you, right? Like what's the oxygen you're breathing, the water you're drinking, and all those things. And then spiritually being just like, what is it that's greater than yourself, right? And if there's nothing greater than yourself, then there was our problem in the first place, right? But like there's got to be something greater. Like if I'm the one all be all, then that's a problem in itself. But so is there something greater than that? And then what bases my values and my morals and some of those things? Like I see people who their food's on point, all these things are right, they've got all this stuff, and then you break it down, and they don't feel purposeful in their day to day. They don't have a value system or a morality within that. And so whenever you can help them gather that, oh my gosh, you know, it's such a game changer for them. So that's kind of the goal, is just spending time learning and talking. Sometimes we'll pull labs, right, which are a way for us to get some markers, you know, that can be helpful in the world of like mold toxicities or understanding like your vitamin deficiencies, if it's that profound. Hormones can be good. And those are things where maybe we send you over to endocrinology, or you go work with, you know, another functional provider that specializes in that, you know, because when you kind of get out of the world of the mind, that kind of is where we move on to some other providers who are out there doing that work and the other concepts. But really, that's the biggest thing, is just getting to spend time with people and listening and just asking them a lot of questions about, like, my favorite question to ask someone is, when was the last time you felt well? Like really well? Like, and I think people just forgot that. Like, I think, and then many times people get so like, you know, wrapped up in their illness that they can't remember a time. How many people do you see that you ask that question to and they're like, I've never felt good? And you're like, okay, that's tough. Let's see if we can figure that out. Let's see if we can move backwards. And it's like, well, I remember as a kid, I used to climb trees and felt really good. Okay. What happened after that? You know, so just kind of piecing that together. That's a big focus.
And it's so striking to me because just as I've gotten older and gotten more in this field, and even this podcast, I've seen and really felt that like a lot of times wellness is defined by how you look and compared to other people that perhaps are in your community or may not be, maybe online somewhere. And so I'm loving this conversation around like, what is your baseline? What does well mean for you? Right. And even as you're talking about the purpose piece, I think 100%, right? Like purpose is something I see in a lot of my clients after we get through a lot of the initial symptoms and patterns, but it's like, you need something to do. Go get a job or work in the animal shelter or just go paint, whatever. But I think we've gotten such a one-track mind around what is purpose. Oh, it's a career, right? What is purpose? Oh, it's having kids, right? And so I'm loving that you're talking about it's not based on society's definition of wellness. It's based on you and like your past experience or what you want.
I think it's so interesting. Like, if you ever go to like a party or you're like a dinner or whatever, meeting people, normally within the first 4 questions, it's always like, hey, what do you do for work? It's like always a thing, right? And so I think it's really interesting when you go to those things and you ask someone like, what do you do for fun?
Yeah.
Like, how do you spend your free time? Like, what did you do last weekend? Those kind of interesting ways. And I think the more we kind of move from our purpose being driven on the system and all the other concepts that kind of go with that, the better you're going to feel because it's about you. It's less about the system that you're trying to be in. Is work part of it? For sure. And maybe you wake up and you feel like fired up about your work, but not everybody gets that experience, right? Some people just due to life and all the things that they've been through are kind of living that and kind of working through that, trying to find their own way. And so what are the things that make you well, right? I think that's really big.
Okay, like how do we manage the noise? Because you're talking and I'm like, yeah, I have friends and clients that they'll spend like 40 minutes to tell me this story and this and that and this and that and this and that. And then I'm like, well, what do you think? And they're like, oh, I haven't even thought of what I think, right? So how do you work with your people on quieting the noise around what to buy, what to do, what's the best routine? Like, how do you help people with that? Because I think that's so key.
Yeah, I think the first thing you have to do, and I mean, it sounds wild, but stop scrolling, right? Like you've got to stop.
That's not the answer we want, Josh.
Oh, no, not the answer we want. My wife would also agree with that. But like the more you go upwards, the more stuff gets brought into your life, right? And that can feel so heavy and overwhelming. And I remember a couple of years ago, I thought that I had like hijacked the algorithm. So I was only looking up like outdoor things. And I was like, oh yes, like I figured this out. There's no like stuff. And then I started feeling like really down because I would see all these cool outdoor things. And I was like in my office all day. And I was like, they got me. So I ended up I just got rid of it and stopped using it as much. But I think the step one is you've got to decide how much you're going to allow in. You've got to set that boundary. And then within that, you've got to identify who do you trust, right? Who are you going to listen to? And maybe that's ideologically, maybe it's not. And you got to be very careful. And there's something about challenging your own thinking. But I think you have to identify those two things, because if not, then you're just going to get in these echo chambers. You're going to listen to stuff and those kind of things. And then 3, does it have factual knowledge to it? If there's not some kind of research study or something connected to it, given it some kind of validity, man, like how many times do you pull up like a true herb that's been used for thousands of years, right? And there's actually research to back it. Whereas like if there's like some random diet, there's not many times, or at least it is for a certain group of people. So know what's being said out there and don't be afraid to kind of dive down those references that's on the bottom of that article.
But how can you look for actual, because my understanding is like these supplement companies like can do their own research, right? So how can we know what is actually valid and factual? That's
a really great point. So one of the best things you can do in the world of supplement, Sean Wells talks about this. There's a couple other supplement creators that kind of fly this flag of, one, getting on the About Us on that page. Is this third party tested? And then if it is third party tested, who is it third party tested by? And if it's not, don't be afraid to message that company and say, hey, who was you third party tested by? Because if they're third party testing their stuff, there's no guarantee, right? So that's step one, is do the About Us, see where it's coming from. A lot of companies now have the NSF stuff on it where that allows like athletes to take it. That's a great one already to know, right? Is that there's no fillers in there that can make an athlete pop positive for something not good. You probably don't need it either. And then the second one would be know where you're buying it from. If you're on Amazon and let's say you look up, I don't know, now supplement, zinc, and you click on it, sometimes they're the manufacturer and distributor. Sometimes they're not. Sometimes some people have bought their bottles, put their own stuff in it, and there are being some bad actors on the internet.
Oh my God.
So don't be afraid to look that up and see like, where is this coming from? because both of those are killers in the world of like, here you are spending $40 on zinc that may be zinc, then it may not be zinc. We don't know because there's not a lot of regulators on it. So the more research you do, the better off you are.
I think it speaks to one of the things that's really feels stark to me right now, which is that our critical thinking skills culturally, from my perspective, seem to be decreasing because there was a time when you were taught in school how to look at references, and I was born in 83. So like this was the time before internet, right? So I'm like, I learned the Dewey Decimal System and I learned that whole thing, but like,
look at you in the encyclopedia.
I know, very fancy, but
yeah.
I do feel like there's a process of critical thinking. And we know in other countries that there's some places where they're teaching kids in high school to identify propaganda. This country, correct me if I'm wrong, I feel like loves propaganda and loves for you to just click on something and be like, yep, read the headline, not even going to read the article, not even going to check, and I'm going to believe it, right?
My father is notorious for that. And the other day I seen him, I recently bought a house. He came down to help me like do some remodeling, and he like seemed so much happier. And I was like, what's going on with you? He's like, well, stop watching the news and stop listening to the news. Because all he would do was get on the headlines, and he'd send the headlines out and be like, can you believe this? And we're like, well, did you click on it? He's like, no, it cost. I was like, either pay the money or like read it. But I think you're right that there is so much noise and it's hard to know what's right and what's not. And I think it's just easy that we take someone that looks a certain way or that has something in front of their name or behind their name, and it says like, oh, that's got to be right. And I think the biggest thing to know is it may be right for a certain set of people. The question is it right for you?
Mm-hmm.
Yeah.
And so there's some people who they need to eat only meat, maybe. That's fine. There's some people who don't eat meat at all. And if you feel good doing that, that's great. But don't continue to do it over and over and over and over just because this person on your TikTok said that was the best way to do it and you still feel like crap.
Yeah. And I think you're speaking to why it's so important. And like maybe I should be worried, but I'm not about like ChatGPT replacing us, right? Because it's exactly what you're saying is we all know the information, but if we keep going to these outlets that just are headlines or ChatGPT or this or that, we're missing the whole point, which is how does it feel for you? Does it help you sleep? Does it make you feel better? Do you feel worse? I just think our whole system is based on like guilt and shame, right? And guilt and shame for not doing the right thing or having the right thing. And now we need this colostrum supplement, whatever. And it's like, well, do you feel fine? Do you not feel fine? And then going at it from that like self place, I think is just so, so, so important.
Yeah, I think I would agree. I definitely would agree with that concept because like, in the world of ChatGPT, you're just taking like what it finds online and bringing it together. And I think it can be helpful to us in certain instances. It does make me nervous, but I'm also kind of a weird hippie. So that's like my own thing. But like,
okay, but you can prescribe meds. It ain't never prescribing meds.
No. And I think what it doesn't do. So one of the things that I do as a professor is we're always trying to write exams and quizzes that beat ChatGPT. That's a thing in academia. And so one of the things like you're always kind of working on. And so one of the things that like we've kind of understood is there's these core things that, AI still kind of struggles with at this moment. And so I don't want to give all that out because some students are going to learn that now. But like one of the things I always see on there, right, is that it won't assess for harm on a case because it's just not, unless there's something that makes it trigger for that, it won't do it. How many times do we see someone who may be having those negative thoughts of harm, but they're not going to bring it up unless we like actually bring it up for them. And so if we don't assess it, so they don't come in and say, oh my gosh, I want to hurt myself right now. They're just feeling really unwell. So I think those are the things that what we do is very different than what AI can do. And I think then you bring in the whole concept of the whole person, right? Like maybe your problem isn't, that you're depressed. Maybe your problem is that you're just feeling really lonely, or maybe the water you're drinking is really bad, or maybe the environment, or maybe the air you're consuming is really terrible. Right. ChatGPT can't find that out. Maybe it can if you type in enough, right? Like I live in this location from this water source and all those things. But we can do the same thing.
It's interesting, especially with our teens, when I'm working with clinicians or the teens themselves. Sometimes when you step back, you realize that if they had one good friend or one strong ally in their school system, that would do 1,000 times more than any therapist could do to support them, because their developmental task, right, is friendship and differentiating and building a social group. And so I think one of the things we really underlook is helping people see that they do need to have a social network They need to have a social group. They need to have connections. Technically, they can still live without that, right? But we're still wired for that. And to me, there's no supplement or medicine or therapy that can fill that role, right?
Yeah, absolutely. I mean, we are ingrained to be in community, in a version of community, right? And so whether we're in, Dunbar's number, which is really interesting, and that's kind of been riffed on a lot. But at the end of the day, we know that sometimes we have too many people in our lives. And sometimes we don't have enough people in our lives. And I think that figuring out what that looks like from an environment perspective is really important, right? And like I'm the same way with the kids I work with. If they could just have one human that they see that is also a human that they possibly could have, like, give a high five to, they would feel better. Right. And it's unfortunate. Like, it's great that we have so many awesome connections and we can meet people who have our interests in those type of things. But then there's also something to be said for having someone that's in your area, living life like you are in the world that you're in. I think there's that really great comment, right? I think I may have mentioned this to you guys years ago. Bill's barn burnt down. I didn't get online and have like no more barn burns for Bill, post. I just went down and helped Bill rebuild his barn, and I think there's something that we lose in that we don't have that anymore.
Well, this has been such a fun conversation. I mean, I could just go on and on and on and on, which is, I guess, why we have a podcast, right?
I think that's the whole problem, solution, issue.
But we wanted to kind of pick Dr. Josh's brain about a few stats and things in the news to get his take. So kind of want to do like a rapid fire question round just to hear your thoughts on these wild stats and wild things in the news, if that's okay with you, Dr. Josh.
Let's do it. Yeah, let's do it.
Okay. So first one is, I heard that Mark Zuckerberg really cares about the loneliness epidemic. It's keeping him up at night. And so his solution to dealing with that is to create 3 AI bots on everybody's phone, so everyone has at least 3 friends to talk to. Thoughts on that?
Yeah, I think that's kind of one of those situations. It's like the company that comes and cuts all the trees down and then they build something nice for the community, right? It's kind of that's the kind of situation. But I think that could it help in the short term? Maybe, right? Like you've got something that's kind of giving you some, feedback. But at the end of the day, you need real people. You need people to live life with. I'm telling you, man, like I've had times in my life where I wasn't living life with other human beings. And then I've had times in my life where I was, right? Like I had friends, don't get me wrong, but true people like you're living in community with. Yeah. And there's nothing that can match that. And what's so interesting is the blue zones are so popular right now, right? There's all this cool stuff. We talk about food and we talk about it. But at the end of the day, the one thing that's consistent across all of them is community. Mm-hmm. There's a sense of community. We know that like older people, for example, especially like Okinawa and some of the other places where even though you're over 90, you're over 100, you still have a purpose in the community. Mm-hmm. You're not just like wrapped up in some, retirement village somewhere. So I think no matter what you're doing, you've got to have real human beings that you're walking life with, because that's the only way we can be a human.
And side note, I know you're in a rapid fire question round, but if you want to see a way, like a sci-fi way that could go, you can watch Sunny. It's a series with Rashida Jones and a bot that her husband creates well, I won't give it away. Watch it. It's great. You'll get creative about it.
iRobot with Will Smith.
What's that?
It's like iRobot with Will Smith. Is it?
Yes, exactly. All right, Hannah, back to you.
Okay. The average wait time for a first psychiatric appointment in the U.S. is over 6 weeks.
I believe that. Yeah, man. We are in a time right now where access to care is so hard. There's so many different domains, right? Lack of providers in certain areas. Some states are way more restrictive than other states are in the world of like access to care and who can do what on top of like managed care entities and those kind of things. I could definitely see that. I know there are some states that are working really hard to, if you're coming out of a hospital, to get in faster. But, if your point of entry is just straight calling the clinic and, hey, I want help. For sure. I could see that, and I see other places where it's longer. I've had times in my life, like as a clinician, where my wait time to see me was like 3 months was my first available, right? You just can't do that. And I was like the only provider in the whole county. So
What freaks me out about that is we all know that the moment of actually reaching out to a provider is often, especially if you haven't reached out before, your lowest moment, right? Like a lot of people feel like they have to be in the darkest spot ever to get psych meds or to get support or help. So that's it's feeling pretty unfortunate.
Yeah, I think that also like illness is progressive, right? And so the longer that it goes, the worse you're going to feel. The inflammation continues to build. You're continuing to have all these imbalances. And then as I talk about in that pillar system, right? Like when one pulls down, everything else gets out of whack, right? And so now like I'll go from just feeling really down to now I can't go to work. And now I can't go to work. Now I can't pay my bill. And I mean, there's this gamut of things that happen. And so the longer it goes, the more problems you have. And then as a clinician, the more stuff you've got to kind of wade through to figure out what's going on. So early intervention, prevention is always the easiest. But like you're saying, if it's 6 weeks is the way to get in, who knows what I'm coming in with.
Okay. Kind of on that theme of what you're saying, early prevention or early recognition. I promise I was listening. Nutrition, sleep, and movement are often more predictive of mood than medication alone. So what are your thoughts on like wearables like Oura Ring, Apple Watch, Fitbit, stuff that helps people have more information about their nutrition, sleep, and movement?
I think it's good to know. Numbers are really helpful for people, right? I think sometimes it can be eye-opening when there's nothing more interesting than when you have someone track their food and they think they're like killing it on their diet and they're like, oh, I only consumed 800 calories today. And it's like, yeah, you don't have enough gas. So I think those things can be really helpful to give you some numbers. I think also remembering that stuff on heart rate and blood pressure, you got to be very careful, right? That's very fluctuating. And so it's always moving. And there's a lot of things. Weight is another one that's always moving. So you need to be careful with that. But I do think, from a provider perspective, it is great to have more numbers, right? If I know like, hey, your blood pressure is running pretty high more days than not, rather than just coming into my office and getting your blood pressure. Oh, hey, like I haven't ate, a fruit in 6 months. That's good to know, right? But then there's also the spin on that where you can track it too much and you can become unwell with that. And I've seen people who do that and it becomes somewhat obsessive. So it's finding that balance with them as well, right?
Jane, do you have thoughts on that you want to add?
I was like, I should probably get an Oura Ring was my thought.
No.
But I do think
you can have my old one.
I think it is kind of incredible. Like our memories aren't really set up for accuracy. I don't think. I think they're set up for survival and they're set up for connection and all those things. So our memories are imperfect. And so I think it's easy for clients to forget, in my office, it's easy for them to forget how they've been feeling. It's easy for them to forget how much progress they've made. And it's easy for them to forget what we talked about last week, So I think there is some tracking that's really helpful. And then I think we know that people overtrack and they can lead to eating disorders and it can lead to obsessions and it can lead to like this obsession with hyperperformance or perfection that's also problematic, right? But I think Josh, what you're talking about is we're looking for balance, right? We're looking for sort of the right amount of these things.
Yeah. And I think you're also, we live in a world where, we can track our food. Yeah. Whereas before, like you ate to stay alive, and like, or you ate to just be part of a community. Like all those things are kind of happening. So it's such a different world to where like we have to kind of track it to ensure it because we're so busy, right? Like we're not having to go and then we can just show up to the store and get whatever we want. So it is very interesting that we're in that place now where tracking actually can lead you to be healthy, but we also have to kind of track our food.
Okay, this is our last one. And this is actually something I probably just learned in the last couple of years. 80% of our serotonin is produced in the gut, which is highlighting the brain-gut connection.
Yeah, I think that's a really interesting concept. One of the things I think that's big with serotonin, and I fly this flag a lot, is serotonin gets, in certain camps, gets a lot more love than it probably needs. And then other times it doesn't get enough love. Serotonin is what we call like a neuromodulator, right? It's less about what serotonin does itself and more about what it does downstream, right? So it's kind of like this otter, if you will, working on all these other river lines, doing stuff downstream. And so because of that, sometimes that's why our antidepressants can be helpful. However, there's a reason that only 33% of people have a full response on those medications. And the reason for that is not all your serotonin's in your brain. A lot of it's in your gut, right? And so because of that, that's why you see every SSRI does what? Creates a lot of nausea, upset stomach to kind of start because you're kind of hitting that. Right. And so we do see where people eat a lot of really bad food or they don't feel really well. They have a lot of gut issues. Like gut is the number one thing I ask about in my physical health portion, right? What's your bathroom like? Like how many times you go to the bathroom? Are you having a lot of upset stomach? What's your heartburn like? Because that's normally an indicator that it could be a driver. Now, is it a symptom or is it a cause? But right on. There is this really thing. It's so interesting that, in utero, the brain and the gut are formed from the same tissue and it opens up. right? And so from that open up, you have these all 15 sets of these serotonin receptors living in both of those areas. Those are the only two organs that share all 15, which is so interesting, right? So this neuromodulator that can touch norepinephrine and dopamine and GABA and glutamate, and it can do all this other stuff downstream for all these other neurotransmitters in our brain that are super pop culture, also live in our gut.
So cool.
So I think for anyone that's kind of like, I'm unsure of if my gut's a problem or not, how do you feel after you eat? Right. And I'm bad about this, my gut may not be the best sometimes. And so if it's not, what can I do to make my gut healthier? Right. Whether that's, using probiotics and, that's a hot topic in itself, but just trying to make your gut healthy, no matter what.
Mm-hmm. It was a delight to have you on the podcast. Thank you so much for joining us. I'm obsessed with the moments when your dog was like, let me in. We've decided that she's a Leo. And I think that she's just like, don't talk about this shit without me. And I get that. I totally feel her. Yeah. You know what I mean?
She wants to be on camera.
I love it.
I cannot wait for my wife to hear this because she's going to laugh so much because she's always, my dog's name is Willow, and Willow so she always finds a way to get into all the things that I do.
Please give us some final thoughts for our listeners, and then please let them know how they can get in touch with you and learn about the work that you're doing. Give them the download on the podcast, which we also posted through Are We Happy Yet? It was such a fun conversation. So give us the spiel.
Yeah. Right. So my little advertisement is more just about if you're looking to feel well, right? And this is an advertisement for me, but just if you don't feel well, don't get stuck in this world where you're constantly feeling unwell and you create a new normal that this is as good as it's going to get, right? Reach out, try to find the good information. There's a lot of people out there on my website. I try to have some stuff. There's guys like Sean Wells and Peter Attea and different functional health people and all these people that are out there, but it's still a lot of noise. And so setting with someone who can help you navigate that world is so important, right? Because how you feel today doesn't mean this is how you're going to feel forever. And so being able to find a way to have that balance, I think is really important. And just because a medicine didn't work for you doesn't mean that you're screwed and doesn't mean that you're going to be like this forever. But also just because a medicine worked for you doesn't mean that's the only thing you need to do. Right. And so, starting with those core concepts. If you want to work with us, you're in Florida or you're interested in the work we do, my company's name is Arukah Well. Arukah is a Hebrew word for just restoration and wholeness. And that's kind of what we focus on there. And so you can check that out at arukahwell.co. Somebody took com, and so I had to use co, which is fine. It feels kind of like a rebel, like co. And then I also am on Instagram. And then my podcast is Mental Maps. I've had this really cool opportunity to have really good discussions with people like Jane and Hannah. And just the whole goal is to figure out why do brains become unwell and how to guide yourself through this world of becoming well, right? There's everything that's out there. And so our goal is to provide just free education for people to know hey, how do I know that something's wrong? And maybe this is something I should talk to a provider about or maybe try for myself. And so you can check that out at Mental Maps Podcast. We're on Instagram, we're on all the different platforms, we're on YouTube, and reach out if you need anything. We're here for you, man, for sure. And I know you guys are in Colorado. There's all these other providers that are out there in different states. No matter where you're listening at, reach out to somebody. We can connect you with someone.
Definitely. And we will link all of that stuff, including our conversation with you on Mental Maps. Josh, next time you're in Colorado, please let us know so we can all go gallivanting in the mountains.
Yes. I want to go back out there so bad. Man. Yeah. I want to go back out there and mountain bike. I was able to roll down the mountain with a snowboard on my shoes. So now I just want to roll down the mountain on a bicycle. But thank you guys so much for having me. Thank you for the work that you're doing. I think it's awesome. Just continue to get that information out there and having these conversations. Man, it helps people navigate this world, right? Which, as we talked about, is just so wild.
Thanks, Dr. Josh.
Thank you so much.
Thank you, guys.
You've been listening to Are We Happy Yet? A Green Roof Studios production.
This episode was recorded and produced by Hannah Buzzo and Jane Thatcher Hahn.
If you liked what you heard, rate, review, subscribe, and share it with someone who needs to hear it. Every review on Apple or Spotify helps us grow and redefine what it means to be well in an unwell world.
Thanks for listening. Try to stay happy out there.